Hi, good night. My name is Andrea, and here we are with another conversation video of the migration and health. And this night we're talking about the social determinants of health, but this time we have three PDFs that I got to analysis. And where um the main points of the readings is the key concept across the three texts is that migration itself is not merely a consequence of social determinants of health, but must be understood as a determinant in its own right. The authors emphasize that migrants' health is shaped less by individual behaviors and more by structural factors such as legal status, access to healthcare, working conditions, and discrimination and social exclusion. So, while many studies traditionally highlight cultural or behavioral explanations, and for example, acculturation, lifestyle changes, and the others argue that this perspective is incomplete. Acculturation, lifestyle changes. The authors argue that this perspective is incomplete instead. They stress that migration status intersects with other vulnerabilities, poverty, ethnicity, gender, language barriers, and often amplifies them, creating unique risk for health. So this point is emphasized in the Israel case study, where irregular migrants face hostile policies, unstable legal protections, and fragmented access to care. So, similarly, the Chilean context stressed that migration can bring benefits to society, but that inequities, stigma, and barriers to services place migrants at higher risk. So, the last one is the others highlight this perspective because it shifts responsibility away from blaming individuals of their health outcomes and instead calls attention to the broader political and socioeconomic systems that shape well-being. This is crucial move for public health as it opens pathways for more just policies and interventions. So I would like to show you this question if there or was anything unclear or confusing to me. And one aspect I found too challenging was the balance between recognizing migrants as a vulnerable group while avoiding their homogenization. And the literature often criticized cultural explanations for being stereotypical or static, yet in practice, public health still tends to generalize migrants as a single vulnerable category. This left me wondering, literally, has how can health system acknowledge that the structural vulnerabilities of migrants without oversimplifying their diverse experiences, right? So another area that could be clarified is the implementation of inclusive policies. While the papers argue for multi-sectoral and rights-based approaches, they provide few concrete strategies for how resource-limited health systems can realistically integrate migrants without generating political backlash. And the next one question is, do what was new to me and did it change the way you think about or perceive things? Something that changed my mind. Um, New insights what struck me most was the framing of migration status itself as a determinant of health. And previously, I thought of health outcomes as linked mainly to poverty, discrimination, or lack of insurance. However, I now understand that the very act of being a migrant, especially in irregular conditions, reshapes access to resources, social networks, and state protections. Sometimes more than socioeconomic status alone. So, this perspective challenged my previous assumption that migration's health impact was mostly cultural, and for example, changes in diet or acculturation stress. Instead, I see how policies, legal frameworks, and state level decisions are health interventions themselves, either protective or harmful. So, um, now some areas for further our exploration. Mhm. And I would like to study more deeply the mental health impacts of migration, especially how prolonged uncertainty about legal status affects depression, anxiety, and trauma. Several students touched on psychosocial health, but did not explore in detail. So, giving recent global displacement to conflict and climate change, I think this area will be increasingly important for both clinical practice and public health policy. So, um, we're going with the next one, and this says, was there anything you would like to explore further or find out more about, and why? Okay, this one is the same that the entire question. It has I want to study more deeply of mental health impacts. The mental health today is the same or even more important the physical care, the physical health, and we need to hear the stories of the people for to understand them, not only for the health physical, right? It's like the mental health too. So, um, personal, um, if I have professional connection with this, yeah, because as a medical student, I have witnessed it in the hospital, in the hospital, how language barriers and lack of insurance prevent migrant patients from accessing timely care. For example, during a clinical rotation, one day I saw a migrant worker delay seeking treatment for a chronic condition because of fear of deportation and inability to pay. This rarely caused the barrier described in the Israel case study: fear of authorities and exclusion from national insurance schemes. Right, and this experience reinforced for me that treating patients clinically is not enough. As future doctors, we must also understand and advocate around the social determinants of health, particularly migration status, which can be as impactful as any medical diagnosis. And at the end, we got a conclusion. This is my favorite part. Is maybe I can feel that I can be more sentimental. I don't know how to say it, but engaging with this with these readings has led me with profound awareness that migration is not only a journey across borders, but also a journey across health landscapes defined by inequality, explosion, and resilience. What I now see clearly is that the experience of being a migrant reshapes every dimension of health, not just access to care, but also the ability to feel safe, to belong, and to envision a future. Um, as a future doctor, this realization carries a moral responsibility. Mm, Medicine cannot exist in isolation from the social, political, and economic forces that shape our patients' lives. To treat a migraine patient is not only to address their physical symptoms, but also to acknowledge the weight of the structural barriers, legal uncertainty, discrimination, and social isolation that impact their health as profoundly as any disease. So, personally, this analysis has shifted my understanding of health equity. It is no longer enough to advocate for equal access to care. We must recognize the unique vulnerabilities created by migration itself and commit to building systems that see migrants as deserving of dignity, um, rights, and protection. And ultimately, health is not a privilege of citizenship, but a universal human right. I'm sure of that. And this conclusion for me is both humbling and motivating. I know that this sounds weird because humbling because it shows how complex and unjust the challenges of migrants can be, and motivating because it calls me as a student of medicine to practice not only with clinical skill but also with compassion, advocacy, and a commitment to justice. This is I want to share with you today, and I'm so grateful for to read this. It's something that really changes some thoughts that I got of the migration. And thank you for watch and for listen. I read this and this PDFs, but you can find it on online and if you want to read too. So thank you and good night. Really thank you so much